Good evening, everyone. I am here to talk to you again about a very important topic that relates to neuropsychology. We are going to be talking about how to effectively communicate with your brain health providers in a way that is going to have you leaving the appointment feeling like you got your questions answered, that you felt validated and heard, and that you have answers and a plan. To me, that is one of the most important things about brain health doctors, is that they should really give you a very high quality education about what has happened to you and give you a comprehensive treatment plan for how to move forward. Hello, Fanny. And it is my privilege to do this as a profession, and part of what I love so much about being a neuropsychologist are those two things: giving people answers and listening intently and compassionately to what is going on and helping people make a plan for how to move forward. So that is our topic for tonight. And remember, why I do this is to empower you with information so you can take it back into your life, back to your doctor's appointments, back to your rehab, back to your relationships, and make them better. So you are here because you've made a commitment to try to improve your functioning and your quality of life. So I hope you give yourself a little pat on the back. So you might be someone who has brain health concerns that I think of as kind of like direct or indirect. So direct might be you've had a stroke, you've had a brain aneurysm, you've been diagnosed with a neurological condition like Parkinson's disease or essential tremor, or you have a physical condition that you are concerned maybe impacts brain functioning. So this is something like type 2 diabetes, hypertension, sleep apnea. Really, the list goes on and on. There's so many physical conditions that can impact brain functioning. But what I think of as most important is anything that is related to three very essential domains qualifies as a brain health concern. So this is either cognitive, and I'm going to explain what I mean by these: cognitive, mood and behavior, or function. And really what qualifies are any issues you feel like you're having, any concerns, any changes, any worries in the realm of how your brain is working. And remember, the brain is really responsible for everything. It is not just there to help our hands move, and it is not just there to help us make memories. It is directly related to our mood and behavior. So we really have to identify what it is that qualifies as a brain health concern. So within the realm of cognitive, what I mean is if you have concerns for you or a loved one with your ability to focus, to pay attention, to make new memories, to learn, to find your words, to comprehend what's happening. Visuospatial functioning, finding your way around a mall and remembering where it is you came from and where you're going. Mood issues are things like depression, anxiety, trauma, the way that you feel, right? Behavior, which also goes along with mood, is more like what you exhibit outwardly. So irritability, agitation, yelling, lethargy, right? It's kind of how your mood gets manifest in your physical body. But also we have functioning, and this is very important because brain health issues can make us not as independent in our everyday life. They can impact our ability to work, to drive, to be social, to be involved in our hobbies, to enjoy our day, to be able to go out into the world, to be able to go out in nature. So really it comes down to any concerns that fall within those three domains. Who are the kind of doctors that you might be talking to about brain health concerns? Well, again, honestly, any kind of medical health provider should care and be able to at least guide you, because the brain is part of the self, right? It is the organ of the body with which the self, the spirit, expresses itself, right? So any person who is trained in medicine and clinical care, to me, is a worthy recipient of your concerns, your worries. But really, when I think of brain health doctors, I really think of 4 or 5 specialties, and I thought maybe we should review those just so we're kind of on the same page. So the first one, of course, is neuropsychology. We are PhDs that are experts in brain and behavior, and we really like to value not just what happens in the brain in terms of the physical issues, but we really like to think of the whole self. How are things affecting people cognitively, in their mood, in their social selves? How is their adjustment to issues that happen in the brain psychologically? And we really are specialists in assessment. We are really good at taking complex issues and figuring out all the contributing factors and giving you a comprehensive treatment plan for each one of those contributing factors. Of course, we also have neurology, and within neurology, these are MDs who go to medical school and then complete specialty training in the brain. We have generalists, but we also have movement disorder specialists who really just focus on motor symptoms like Parkinson's disease or essential tremor. We have neurologists who specialize in things like multiple sclerosis, neurologists that specialize in other things that can happen to the brain, like brain tumors, right? So even within neurology, you can get a couple different service lines. And then, of course, we have the very important support medical providers that allow those doctors to really do a good job and implement a rehabilitation program. So I'm thinking of speech and language pathologists, neurological physical therapists, occupational therapists, and mental health counselors. These are really the group of people that I think make up the core of brain health providers. When I was thinking about this talk, I wanted to, as always, make it very doable, right? So I'm always thinking of like, what are, 2 steps, 3 steps, 4 steps that I can give you that when you're done hearing me talk, you can remember, okay, this is exactly what she said to do. So the way I'm thinking about this is that to make the most out of your brain health appointments, I really want you to think about 3 distinct phases. The first one I'm kind of thinking of as the pregame, okay? This is your preparation, and I'm going to tell you everything that I want you to do in a perfect world to prepare for an appointment with your neurologist, with your mental health provider, with your neuropsychologist. The next one is the actual appointment. So what should you actually be focusing on during the appointment? And then the next one, of course, is follow-up. And this is where we are doing a pretty bad job as medical providers, because we can talk a good game during the appointment, but human nature being what it is, there are sometimes difficulties with follow-through. And you have to remember that that doctor has many yous, but you only have one doctor. So what I'm going to tell you tonight is a little bit of tough love, that part of what we have to do to get the most out of our brain health care is to become fierce advocates for ourselves or a loved one and really be on people's butt to make follow-up care happen, because they're not necessarily going to follow through with everything they tell you in the appointment, even if they have the very best intentions. Referrals get lost, they don't get made, there's pre-authorization issues, there's all sorts of things going on. So we got to talk before the appointment, and after the appointment. So part of the preparation that I want you to be going through is attitude. I want you to come into these appointments with 2 key concepts on your mind. The first one is that you are going to communicate in a way that is assertive and respectful. That is the way you are going to make the most out of these appointments. Okay, so what do I mean by assertive? What I mean is that you are going to give as much respect to that medical provider as you would ask for yourself, right? I think that we really need to work on, of course, respecting medical doctors for what they do and their expertise, but we also need to value the expertise of the patient who has actually lived the life experience with the brain injury, the brain health concern, that is walking into our office. So to me, both people share expertise, and the 2 working together are what's going to get us the best result. So what that means is you can't walk in there thinking that it is only your agenda that matters, but you also can't allow the physician or the psychologist or the therapist to be the only one in the room with an agenda, okay? So I want you to try to balance the power in the room and try to find a nice balance between letting them do what they need to do, but also making sure that you are advocating for yourself. Okay? The next one is being respectful, and I think a lot of us are this way naturally, but the truth is that it can be infuriating to go into medical appointments time and time again and feel like it takes you so much work to get there, you're paying for parking, and here you go an hour and a half late for the appointment, and in 10 minutes you're done, and you basically leave without anything new, nothing, no new tool in your toolbox. It can be infuriating. And it's very easy to want to take it out on people. But part of what you need in order to get the very best brain health care that you can is you really have to have an attitude of respecting that the doctor of today is different than the ideal doctor we all want. Okay? The doctor of today has tremendous pressure on them to see a high volume of patients, okay? And this is why we've seen a mass exodus of doctors, frankly, including myself, that are leaving academic medical centers and going into private practice because we don't want to have to practice that way. But not everyone can do that. And I truly believe that the vast majority of medical providers, doctors, go into this because they truly want to help. These are the helping professions. But along the way, what happens is many of us become administrators. We become paperwork princesses. And that's not what we signed up for, and we're not happy about it either. I don't know one doctor that likes to be on the computer with their back to you when you are talking, right? As much as you hate it as a patient, I'm here to tell you, a lot of us are very heartsick about it on the doctor's side too. So part of what you have to accept when you go to the doctor is they are crunched for time, and that's why it is on you to prepare and make the most for that appointment. And I'm going to hopefully teach you how to do that tonight. So this is important because there is data that suggests that only 23% of people that go to the doctor are able to finish their opening concerns, their opening complaints before they are interrupted. Is that not unbelievable? A more recent study was actually trying to break this down into seconds, and what they found is that patients typically talk only about 12 seconds before they are interrupted by the doctor. So this gets hard because we are socialized often to think that the doctor is the most powerful person in the room. And remember what I said before, I want you to have providers that value your expertise as much as they do their own. But remember, that doesn't mean that they sometimes don't have to get to some questions. So we have to find a way to balance the time that's allotted for your specific appointment. So part of what I want you to really let sink in is kind of a mantra as you prepare for your appointments, which is that you really do have a right to understand what has happened to your brain and to have a treatment plan offered to you that addresses all of your brain functioning concerns, not just physical, but cognitive, mood, behavior, and function. And I really want you to think about the brain like that. So why is it that I harp on these 4 symptom clusters? Well, it is because specific parts of the brain work in multiple systems. One part of the brain typically does 3 to 4 things within the physical self, the cognitive self, within mood and behavior, okay? So very few people have trouble using a hand that also don't have some trouble emotionally, socially, or cognitively. The problem is we have a disproportionate focus on the physical. And why do you think that is? It's because we can see it, we can assess it, it's clear to us. Part of the reason why many of us love neuropsychology so much is because we value what can't be seen. We want to help people be validated for the symptoms and struggles and issues that aren't readily visible. Okay, I can't ask my patients to walk down the hall and see that they have a broken heart that their spouse left them after a stroke. But these things are just as valuable as it is if somebody needs a walker to ambulate. Okay, so essential part of your pregame, so remember we're talking about 3 stages, so your pregame, you know you got an appointment coming up, is I want you to spend some time in reflection and then do some documentation. So maybe we'll call this our R and our D, okay, reflection, documentation. And what I want you to do is really spend some time thinking about what are your brain health concerns. If you've had an injury, what exactly has changed and how is it impacting your function? And maybe not just listen to your own self, but get someone that you trust that is a loved one and ask what their opinion is, okay? And what is critical is the concept of what has changed and how has it impacted you, okay? So this is key because what is unusual for me might not be unusual for you. And somebody who's always had attention problems, focusing on attention problems now is not going to be as helpful as talking about what is a difference in functioning, a difference in thinking, a difference in feeling than something was, say, before a brain injury. Okay, so thinking about impact is critical because this is the humanity behind the complaints. How has this affected someone's safety, their independence, their ability to work, to drive, to function, to be with other people? Then I want you to start writing this stuff down, okay? This is gonna help you focus the appointment. This is going to help the doctor have to respect your time, your concerns, and this is how you're gonna balance out some of that power differential. So what you can do is take a blank piece of paper, make 3 lines on the piece of paper, and I want you to write on the top section, questions. The next section, I want you to write symptoms, and on the next one, I want you to write help. And I want you to bring this piece of paper in with you to your appointments. And I want you to say when you walk in there, I have prepared for this appointment. And I want to make sure once you've asked me all your questions that we have time to go through my concerns. Okay, so you're going to set the stage right from the very beginning. So what do I mean by questions? I want you to ask yourself, do you have any unanswered questions about your brain and what has happened to you? I cannot tell you how many times people have come to see me who have had a stroke and do not know where in their brain they had their stroke, what that part of the brain does, what were the risk factors that led to the stroke, okay? So if you have any lingering questions that you just have never had a good answer to, this is where you have to start, okay? It is an information gathering mission, okay? The next thing is that when your doctor explains to you what that information is, I want you to feel justified in asking for a repetition. Ask them to say it a different way. Ask them to draw it out. Ask them if they have pictures. If you don't get it and they talk in jargon, it is their responsibility to explain it to you in a way that makes sense for you. Do not walk out of that room unless you feel like you really, really, really get it. In your next section, you're going to write symptoms, and I want you to go through all the ways that the brain functions and operates. So remember, we have cognitive, mood and behavior, and physical, okay? And what I want you to do is focus on a few different things here. The first one is timeline. I can't tell you how important this is. There is gold in them there hills. This is the way we understand brain functioning, is when did a problem start? How has it changed over time? Okay, does it get better? Does it get worse? What makes it better? What makes it worse? Has it just been a decline and then it's been stable? Has it been up and down? The onset and the course of symptoms is critical information. The next thing I want you to do is bring examples in from everyday life. This is what makes symptoms or complaints understandable. This is the language of medical providers. We can think through how your explanation might make medical sense, okay? And the last part of the letter that you're going to bring in, remember I said it was called help. This is where you're going to ask for what you need help in most right now. Asking the doctor, this is what is bothering me most. What do you recommend, or do you have another specialist that can help me with this specific problem? Okay, so you're going to go in with your questions, you're going to go in with your symptoms and their impact, and you're going to go in asking for a very specific type of help. Now, right before I came to see you today, we actually had a local counselor come into my practice to talk to me and the awesome people that work with me about her journey as a counselor. And as she was ending, she was talking about the importance of asking for what it is you need. But she added a little caveat that I thought I wanted to tell you about. And it's making a realistic request. And she said, you can't go into McDonald's and ask them for a filet mignon, right? but you also can't stand in the back of the McDonald's and never place your order. So you kind of have to be realistic. What kind of person is this doctor? Are you going to be able to go in there and pour your heart out and say, my marriage is on the rocks, my husband does not understand why I can't get back to work? Are you going to have a proper audience with this person? Or is that really better reserved for one of your other doctors who maybe seems to be more comfortable talking about those things? Likewise, you're not necessarily going to bring your newfound difficulty with smell to your speech and language doctor, right? So you kind of have to do some thinking, maybe with a loved one, about what is the right doctor to talk to about what specific problem. So as you are sitting there in the appointment, I want you to check off the topics as they get discussed. So that way you have a sense of accomplishment. You know that you worked through the things that were most important. When you are done with this meeting, if you have someone there who has a good memory, awesome, so they can help you remember what was said. You can also ask the doctor if you can record the appointment. Many of us have smartphones. Some doctors are fine with that. Other doctors feel like it's an invasion of their privacy, but you can certainly ask, right? That's a fine way to remember. You can also ask the doctor or the nurse to give you a summary of the most important points that were made throughout the appointment, because if you have a cognitive problem, you might not necessarily retain the benefit of all of this hard work, all these questions you've been asking. The other thing is that for me, anyone who has had a brain health issue, a challenge, an injury, should have a neuropsychological evaluation. Sometimes these are offered to you and maybe you didn't even know about doctors like me before, but many times I have found that people have to advocate for them. And what you might have to do is explain, that you've been watching this Dr. Sullivan on Facebook and that you understand what a neuropsychologist does and you would like a referral to go see one. Many, if not all, most medical insurances will pay for a neuropsychological evaluation based on medical necessity. If you have had a stroke, my goodness, it's certainly necessary. If you have PD, if you have essential tremor, if you have MS, there's all sorts of things. But generally, any brain health concern that comes to me, I can write it up in a way that it is medically necessary, because we have to explore the idea, is this a neurologically based issue? And don't forget, neuropsychology, right? So sometimes people have overlapping psychological issues. Maybe you have Parkinson's, but you also have anxiety. Those things are also fall under medical necessity. If you need a referral or a name or a contact number for a neuropsychologist near you, you can text us at the Facebook Messenger app, and we are able to get back to you and tell you the person closest to you who is board certified in neuropsychology to help you. The final thing, remember, is once you close that door and you walk back out to your car, that's not the end of your advocacy. You have follow-up. And what do I mean by that? At the end of the appointment, you are going to ask the provider, what are the next steps until I see you again? I want you leaving every appointment with homework, with action steps. This is how you are going to be an active participant in your personalized brain health care. Many times, like I said before, referrals can fall through the cracks. So you or a loved one should call the next week and say, hey, I talked to Dr. Sullivan. She talked about referring me for another round of physical therapy. Was that referral sent? I haven't heard from them. I'm waiting for my prescription. It seems like it hasn't come in. You can use something like those patient portals that they have, right? Sometimes doctors email with their patients. So I want you to take advantage of these types of communication. So, I am not an idealist. I like to say that I am an optimistic realist. So I knew I had to conclude with the reality is, what if you hit resistance? What if you bust out that piece of paper and the doctor is like, excuse me? If you have someone that doesn't want to partner with you in your journey for brain health. The ways I want you to evaluate this, of course, some doctors can come right out and say it, and they don't have time and they don't want to help you think about an issue. But honestly, if you feel rushed, if you feel invalidated, these are all reasons to switch doctors, to get another doctor. And I know sometimes you don't have a lot of choice, but you can certainly do your best to see if there are other options. The other thing within the world of being assertive is you can say things like, I realize that I am one of many to you, but you are my only neurologist, and this is 15 minutes of your day, but I've been waiting for this appointment for 6 months, and I really hope that we can answer my questions here. I'm out here trying to do my best, but I need you as my doctor to work with me so I can have the best recovery, so I can be the best mom to my kids, so I can be the best friend to my friends, right? Yeah, I think appealing to doctors' humanity sometimes and cutting through the busyness of their day and just showing them what is really bothering you and being really real, not keeping a stiff upper lip. I really think that that's an effective strategy, and I think it's well within your right to do that, okay? So when you leave a brain health appointment, I want you to feel really justified that 3 things should be in your heart and in your mind. This is that you were heard, that you got answers, and that you have a plan. If you do not feel that you got those 3 things, then I'm telling you there are opportunities to get it elsewhere. I know that some of you are listening in parts of the world that you don't have access to neuropsychologists, and really that's part of why I'm here, is to try to fill in those gaps. And so if the best that you have is the internet, you're gonna have to get real comfortable with YouTube and videos like this to try to fill in the gaps in your knowledge and in your treatment plan. If there's anyone out there that's listening with that kind of a situation, you can write me a little message under this lecture, and I'm more than happy to try to focus on something that is important to you in a future lecture. So really, what is the take-home message about our time together tonight? It's that you have to be your own advocate. Medicine is changing. The amount of education and the quality of your treatment plan really matters, and you have a right to request what is reasonable. And I think that walking out of the appointment feeling heard with answers and a plan is really completely reasonable. I will be back next Wednesday, and we're going to talk about therapy and if therapy would be a good idea for you. And I'm going to try to help you understand exactly what it feels like to be in therapy and how you would start something like that and where to find a good provider. There's a lot of people that know it would be good for them, but they just don't know where to start. So we're going to talk about what are the steps to get people into supportive therapeutic environments. So thank you guys so much. I hope that this was helpful. Please like it and share it. There's so much pain out there that is so unnecessary if we just empowered people with tools, and I hope that this series is something that really makes a difference. So thank you guys so much, and I'll see you next time. Bye-bye.